Hello, my name is Talisa Ramirez. I'm in BSN 246. I'm doing the nasogastric tube insertion video. I have on my correct scrubs, correct badge. I have all of my supplies here. First, I would check the provider's orders. This patient does not have any order for suction, so I would gather my supplies, go to my patient's room, knock on the door, provide patient privacy. Hi, my name is Talisa. I'm going to be your nurse today. Can you tell me your name and date of birth? I verify patient's name and date of birth. Okay, so Ms. Smith, the reason that I'm here is because your doctor has ordered a nasogastric tube to be inserted on you. This is used to help with feeding and help with medication administration. Do you have any questions or concerns? No questions or concerns. Okay, so I'm going to perform hand hygiene, apply my gloves. I'm going to get my stuff together here, lay my stuff out here. Okay, to get my patient in position, I would raise the bed, sit my patient in high fowlers. Okay, so I'm going to begin with checking my patient's nostrils. So can I get you to hyperextend your neck? Okay, checking my patient's nostrils. Nostrils are moist and intact. No irritation, no abrasions, no deformities, no obstructions. Okay, I'm gonna check the paint seat of your nose. Can I get you to hold one nostril and breathe? Okay, hold one nostril and breathe. Okay, patient's left side has better airflow than the right side, so we'll be using the left side. Okay, so next I'm going to put my tubing into warm basin of water. Next I'm just gonna get my patient set up here. Put my towel down. I'm gonna get my tape together. Okay. So next I'm going to measure my tubing from her nose to the earlobe to the tip of her xiphoid process. So we're going to go from the nose to the earlobe. Okay, down to the xiphoid process, and that is at 50. Okay. Put my tubing back in here. I'm going to get my lubrication ready. Okay. Okay, so I'm going to get my tubing here. I'm going to lubricate my tubing. Okay. Now my patient's neck is already hyperextended. So I'm going to, when you insert this tubing, you want to go with the natural curvature of the tubing. You want to insert and go along the nostril floor towards the ear. So we're going to insert. So, okay, insertion. Okay, towards the ear. Okay, so now once I've reached the oral pharynx, my patient has a cup of water here. I'm going to get my patient to lean forward. Once I reach the oral pharynx, my patient should be gagging. My patient will begin to drink the water, and I will insert 2 to 4 inches. So as they swallow, so swallow, okay, swallow, 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 swallow. Okay, we're at 50. Now if I'm gonna secure my tubing, patient's tubing. At any time, if I felt resistance against the tubing, I would take the tube out and re-lubricate it and use the other nostril to begin. Okay, now that I have my patients secured, I want to gather the tubing. I want to draw up 30 ml of air. Okay, I would, while the tubing is kinked here, I would insert my air. Okay, now I would pull back 10 mLs, 5 to 10 mLs. I would kink my line back. Clamp my line back together. Next, I'm going to secure my patient's line on their gown. Okay, I'm going to check the gastric contents. Okay. Patient's gastric contents are at a 3. Per hospital policy, it needs to be between 1 and 5. My patient is at a 3. Okay, so next I'm going to get, I'm going to lower the bed. We're going to get x-ray to come in and verify placement. X-ray has came in and verified placement. So next I am going to, if my patient doesn't have any suction, but if my patient had suction, I would connect all of my tubing. As far as checking characteristics, if my patient had any drainage, I would check the characteristics of the drainage. I would document the amount of drainage. My patient is, the bed is lowered. My patient is in a comfortable position. As far as documentation, I would document that how my patient responded to the procedure, drainage, any characteristics, anything that happened, I will document on my patient's chart. Okay, I would remove my gloves, perform hand hygiene, and that's it.